Hi guys, so today's video is going to be a waxing FAQ, and basically what this is just going to be frequently asked questions that I've gotten over my sort of time waxing. It's also questions that people asked all the time, hence frequently. So yeah, I'm just going to go ahead and go through this. This video might be really long, but it's going to hopefully answer some questions that you may have, and yeah, so let's get to it. Why you would really choose waxing over shaving is, one, the fact that it lasts so much longer than shaving. With waxing, what you're doing is you're actually removing the hair at the base of the follicle, so you're pulling the whole bulb out, as opposed to shaving, which just sort of, say this is a hair, it just cuts it off right at like this level, whereas waxing would take the whole hair out. So yeah, it's basically like the length of time between having to remove hair. Shaving, you can have stubble the next day, whereas waxing can take like a little bit longer. Over time, when you continue waxing, your hair goes back thinner and sparser. This is something a lot of people are like, is that true? Yeah, it is true. The repeated like ripping the hair out of your follicle, it actually sort of damages the follicle so that your hair will end up growing back thinner and more sparse, because over time it can actually kill the hair growth process in there, so your hair doesn't grow in that spot anymore. Also, shaving can cause razor burn. We all have razor burn, I'm sure, on legs from just quickly shaving. I know I've done that numerous times. Shaving, you can also cut your legs open, stuff like that. Also, with razor burn, your hair, when you remove the top layer of skin, which is technically what razor burn is, the skin that grows there grows back harder and more like scalier, so your legs will actually end up drier. Whereas waxing, what it's doing is it's removing dead skin cells along with the hair so that your legs actually feel smoother than they would when shaving. So that's probably why you should choose waxing. I sort of kind of answered that, but basically it can last anywhere from 2 to 6 weeks, depending on where you get waxed and your hair growth cycle. If you know that your hair grows back fast, then yeah, it is going to grow back a lot faster. Another thing too, it really depends on the coarseness and your ethnicity. For example, redheads with more blondish redheads. Paler skinned girls with more blonde and stuff like that, their hair might not grow back as quickly as, say, somebody from like Middle Eastern descent who has thicker, coarser, darker, blacker hair. It really depends on the person, but generally speaking, anywhere from 2 to 6 weeks. Also, the whole thing with repeated treatments. When you get waxed, your first treatment, basically what it's doing is removing all of your hair, obviously. Now, the hair that you're removing then is in all different levels of hair growth. There's 3 different stages of the hair growth cycle, basically like baby hair, middle-aged hair, and hair that's old and about to fall out, just putting it simply. So you're removing all of them. So when you remove all of them, you still have some hair that are in the stage of growing up. You have some hair that are completely gone or starting from baby, and then you have some baby hair. Basically what this means is that the first time you wax, your hair might grow back patchy, and generally speaking it will go back patchy, and this is because you're removing hair, all of it, and then again they're in different stages. So with repeated waxing, what it's going to do is it's going to take hair from each of those stages as they progress to a length that's able to wax. So say you get waxed the same place maybe like 4 or 5 times, all the hair will then be at the same hair growth cycle, so that when they all grow back in, you can rip all of them out, so that when you, it basically extends the time between waxing. So you might not have 2 weeks, you might have a full 6 weeks before you have to wax again, because all the hair is at the same level. Hopefully that makes some sense. No, this is a myth. This is a total myth when it comes to waxing. Actually, your hair seems darker and thicker because what you're doing, it's the same, it's basically getting worn. So like, say hair on your arm, I have no hair on my arms, but like say you have hair on your arms that you've never waxed or done anything to ever. Over time, from sunlight, your hair is going to get lighter, and then from like friction on your clothes, your hair is going to get thinner. So that if you were to wax that hair off, the hair that grows back is actually your natural hair color. It just hasn't been exposed to the sun, so it may appear a little bit darker, but that is your natural hair. It's not that it's getting darker from waxing, it's not that it's getting thicker. You will always have the same amount of hair that you've always had. So, yes. Shaving, too. The reason why waxing, when it comes back in, feels softer than shaving is because shaving is, again, removing the hair right at the base so that it's a blunt hair when it goes back in, whereas with waxing you're removing the whole hair so that it starts to grow, so it's a lot finer on the tips. So that's why shaving feels a little bit more stubbly than when waxing goes back in. Waxing goes back in. I can't talk. Yes and no. This is a yes and no question. Everyone has different pain tolerances, so somebody could go in and get a Brazilian and be like, oh, that was nothing, whereas the next person will be crying for 2 hours. It all depends on your sensitivity. It also depends on the place. Underarms hurt more because it's a sensitive area. Obviously any sort of like bikini Brazilian genital area hurts a lot more. I find me personally around the ankles, if I'm getting my legs waxed, is a little bit more sensitive than say around like my knees or like my thigh or something like that. I just wanted to put that out there. But yeah, it's basically depends on your pain tolerance. Yeah, also, it is suggested that you do get waxed 2 weeks after your period, and then sort of like 2 weeks before your period, just basically because a week before your period, your skin is a lot more sensitive, so it's presumed that it hurts more during that time. I think it feels fine regardless, but that's what they say. Also, if you are going in to get like a Brazilian or any sort of waxing, you can take a couple Tylenol before. It sort of numbs the pain a little bit, but just yeah, keep that in mind. This is something that a lot of people ask, and it's something that they sort of freak out about, like, is my hair long enough? Is it too long? Basically, the standard length is anywhere from a quarter of an inch. It has to be at least a quarter of an inch to half an inch. Now, if it's too long, what they might do is they might trim it. It really is up to your esthetician or your waxer in that case, so that they might trim your hair. And then if it's too short, then they're not going to wax you. They'll probably send you home and like rebook you for an appointment. Basically, it has to be a certain length so that the wax sticks to it, so that it rips off easily and that you'll get a good result. Because the waxer doesn't want to sort of give you like a patchy waxing job, so they'd rather send you home and wait for your hair to be longer than just go ahead and wax like baby hair that you have. Yeah. And also, basically, a quarter of an inch is essentially like 2 to 3 weeks of hair growth. Again, depending on how fast you grow hair. This is another sort of differs. Prices do differ from salon to salon and from area. Higher does not necessarily mean better. Neither as lower does not necessarily mean worse service. This kind of goes into my next question, but yeah, so there's all different prices. You just have to find a place that's right for you. Mine personally, I've gotten Brazilians done for 20 bucks, and that's really cheap. They can go up to 60 in some places. So this goes into my next question. One thing, they should definitely be asking you questions, or should have a sheet when you come in if you've never been there before, basically stating all of the contraindications that you may have to prevent you from waxing. Just a little bit of like sort of your waxing history, so that they know going into it if you have any sort of problems. They should definitely make you fill one of those out. Another thing, they should have clean paper laid down, especially if you're going in for something like a Brazilian. They should have clean surface area with new paper for each client. Another thing, this is a big thing. If you are going in for what I call a cheap Brazilian, which is again what I said, like I've had the ones done for like 20 bucks, I do suggest getting something like maybe your underarms done and your Brazilian, and request that you can get your underarms done first. This is the reason. The reason is because you want to make sure that your waxer is never never double dipping. Double dipping basically means that you have a pot of wax and that they're using the same stick. This is highly unsanitary. It's not right at all. And for me personally, I'd rather have them double dip for my underarms than my bikini area, Brazilian, you know. So make sure that your waxer is never double dipping, and if they are, mention it to them. Be like, hey, are you double dipping? And then see if, like, why what the response is for that, because they should never ever be doing that. So yeah, anybody who is double dipping out there, no, don't do it. Again, goes into my next question. This is something that a lot of people is sort of controversial about, even in like the aesthetics world. It really is all up to the waxer, and it's all up to the establishment. So like if they work under sort of like a chain that tells them, hey, you have to wear gloves, then yeah, they have to wear gloves. However, some waxers prefer not to wear gloves. Again, there's nothing wrong with either side. It's just the gloves help to prevent any blood transfer. Because sometimes when you do get waxed, there is a little bit of spotting with blood because you are ripping the hair out of the follicle. But yeah, so basically it's really up to the waxer. Like, I've had Brazilians done where the ladies don't wear gloves and they're just like, nah, you know, they don't care. They wash their hands when they're done, before and and after. And it's really up to them. So if you go to a waxer that doesn't use gloves and then you go to a new one and they use gloves, it's nothing wrong with you. It's just their personal preference. There is a lot of contraindications when it comes to getting waxing. For example, people with diabetes, again, I'm reading off my notes because I don't want to mess this up. People with diabetes, varicose veins, or open sores, or any sort of like skin problems like eczema, stuff like that, you don't want to wax them because they might be more prone to infection. Again, diabetes means that you don't heal as fast, so yeah. Also, waxing is never done on a client using any skin thinning or acne medications. Basically, like your Accutane, your Retin-A, Renova, anything like that. And also if you're on blood thinners, because, again, self-explanatory when it comes to any sort of bleeding. Also, your waxer should be discussing any food allergies. If you have any food allergies, bring it up to them. Or like any allergies in general, because you could be allergic to aloe, and that might be in sort of like a waxing after lotion. You could be allergic to honey or bees, and that might be in a wax. So make sure that you discuss that. Number one, avoid the sun, especially if you're getting any sort of facial waxing done, like upper lip, chin, eyebrow. Avoid the sun, use sunscreen, because you might actually get hyperpigmentation in certain areas if you burn, which is not good. You want to sort of avoid exercise for like 10 hours or so, because you sweat and then that's going to get into your open follicles. Again, same thing goes for saunas, pools, anything like that, because your follicles are open, you don't want any bacteria to get in. Another thing is, do not exfoliate for at least 24 hours. And then also, if you're getting your underarms done, avoid deodorant for your underarms for 24 hours. I know that's a hard one. And then for Brazilian, avoid any sexual contact for 24 hours. That one can be cheated a little bit, but again, don't have unprotected sex with anybody after you get your Brazilian done, because, yeah, not good. Yeah, so basically those things, they all help to prevent infections. And then after waxing, what you should do, after you wait about 48 hours, you should be exfoliating the area, because gently exfoliating depending on where you've got it done, just because the hair will help to not have ingrown hairs after. You can expect redness and sort of little red bumps, and basically what that is when you pull their hair out, it just gets red and inflamed, because it's normal, perfectly normal. It may go away within a day, it might go a little bit longer for some people, depends on the thickness of your hair. And then, like I said, some people may experience a little bit of bleeding, which is also normal for thicker hair. This is a question that's been brought up quite a bit in my sort of waxing world. Basically, yes, it does. When it comes to eyebrows, when you're doing waxing, you do have to pull the skin taut, and like same thing for like upper lip, and it thins the skin, and what it does is it just removes any dead skin cells. Now, if you're getting frequently waxed, it will loosen your elasticity in your skin just from the fact that you're pulling and it's pulling the skin. So that's something to definitely look into. For me personally, I prefer sort of just waxing not waxing, tweezing my eyebrows. Yeah, so just keep that in mind if you're waxing your eyebrows all the time, because you don't want to have sort of saggy eyelid area. Yeah. So that's a little bit it for my waxing FAQ. I do hope that helped out a little bit. Okay, so I'm actually not going to include my waxing kit in this video because it's already really, really long. So I will include that in another video. Yeah, so until my next video, I do hope you guys all enjoyed this and it was somewhat helpful. And yeah, so I will talk to you soon.